Good evening, all. This is from NSI Bangalore chapter. It is knowledge sharing series. Okay. Today we have in our midst Dr. Jyothy, presently working as Assistant Director, Faculty in National Institute of Public Cooperation and Child Development, Regional Center, Bangalore. Then she has more than 25 years in training, research, involved and coordinated with state governments in organizing training programs, implementing government programs and schemes, delivered talks as resource person in many platforms, schools, colleges, NGOs, government departments, etc. She is a PhD degree holder from with food science and nutrition from UAS GKVK, and she is also executive committee member of NSI Bangalore chapter. So on behalf of our NSI Bangalore chapter, we welcome you, Dr. Jyothy. Over to Jyothy ma'am.
Thank you, Dr. Sundarali. Good evening to you all. So it's a pleasure to join once again with the NSI experience sharing or knowledge sharing sessions. And I also thank the members, executive members of the NSI to be a part of this and share whatever the government programs are there for achieving the food and nutrition security. So I know that there's a lot have been done by food industry, food processing and agro processing and all that. But the ultimately everything, everybody is again boiled down to the achieving this food and nutrition security. So apart from all the private sector, what are the government or government interventions for achieving this food and nutrition security? So that is my topic to share with you in this knowledge sharing session. My screen is visible? Lakshmi?
Yes, ma'am. Yes.
Yeah, you can see. No? Yeah. So my topic for today is women and child developmental programs. As Dr. Sundaravali introduced, that I'm from the National Institute of Public Cooperation and Child Development, and we are involved with all the activities under the Women and Child, as it is the Ministry of Women and Child, under the Ministry of Women and Child. So we will look into, I'll just briefly in another 45 minutes or so, take you to what are the food and nutrition security interventions by these government programs. So definitely we know that United Nations has already told that 195 million children are going hungry and malnourished, and this food and nutrition security is really a challenge in India to achieve this food and nutrition security, because not only of the huge populations, but there is high levels of poverty and malnutrition. Though we are good in this agriculture sector, particularly with the fruits and vegetables and milk and cereals, but even then the food availability is threatened by the effects of this climate change and declining water resources and agricultural output. And now with this COVID-19, and with these climatic conditions and other natural calamities, we have to really think of what will be the situation in the post-COVID. And there are also Millennium Developmental Goals, where the country in 2016, it has been reported that most of the countries are involved in achieving these Millennium Developmental Goals. It is noted that despite India's significant progress in these we have 8 Millennium Developmental Goals to achieve, but more sustained efforts are required to accelerate these achievements, particularly related with food and nutrition security. So to achieve these 8 Millennium Developmental Goals, there are 17 Sustainable Developmental Goals, where the agenda to achieve is by 2030. And one interesting thing is that out of the 17 Sustainable Developmental Goals, at least 12 of them have the indicators relevant to the nutrition. And we are actually working towards this SDG 2, that is zero hunger. And if you look at the other sustainable developmental goals like good health, well-being, gender, quality education, clean water, so most of these has the nutrition link in it. And even the high levels of malnutrition are also cause of serious concern, though we feel that there is high rates of economic growth, or India is GDP is increasing wherever it is. But even then, when we come to the malnutrition status, it is really a serious concern because the progress is there, but how much progress we have achieved, the percentage of progress, how much to be achieved is not a heartening result. So now we see that our country is looking forward to place in the League of Developed Nations to achieve this 2030. But exactly where do we stand? We know that our country is much well advanced, even Chandrayaan, and we are even, what to say, trying to go into the space, into the moon, land on the moon and Mars. So much of technology also intervention, more of updated technology we are having. But even if you just look into just the issue of health and nutrition of women and children in our population, where do we stand actually? So these are the I should say that the health and nutrition of the women and children is the prime concern because it affects the intergenerational human resource capacities. And along with this problem of malnutrition in our country since decades, I think before 1975 onwards, 1975 is the program on many nutrition programs which have come up. But even before 1975, our country has been grappling with this problem of malnutrition. And still this we are not able to achieve in this more than 30 years also. And now, along with the double burden of the malnutrition, that is overweight and underweight, now we have come to the triple burden, that is anemia. If you look into the levels of anemia and the percentage of anemia among the women, it is even in children, it is more than 60-70%. Even pregnant mothers, it is 70%, and which will really affect the overall physical, motor, and all the developments, overall development of the children also. And the vulnerable groups are the children, pregnant and lactating women who are most affected. And there's also retardation of cognitive and physical growth, increased susceptibility to infection, which ultimately affects the productivity, human resource capacity of the country. Even the recent report of Global Nutrition also says that one third, that is third of the world's stunted children under 5 are in our country, and 38% of children under 5 are affected by stunting. 21% of the children under 5 has been defined as wasted or severely wasted, and 51% of the women of reproductive age suffer from anemia, and more than 22% of adult women are overweight. And there's also one report by UN World Food Programme, which they projected that 1 in 3 Indian children under 5 years will be stunted by 22, going on by the current trends. And now with this is before COVID situation. Now with this COVID situation, it may increase also. And over the last decade, child stunting, which is a measure of chronic malnutrition, I know we have had many of these sessions in the last week under the World Breastfeeding Week. So we know that stunting is a chronic malnutrition. And though it has reduced at a rate of 1% per year, but this slowest decline is decline is there even with the emerging economies. Then for children 5 years or younger, 98% are waist and 42.4% are underweight according to NFHS 4. And though both showed a decline from NFHS 3 figures. But still the numbers are staggering, with 46.4 million children under 5 being stunted, 25.5 million wasted, and 97 million children being underweight. And along with this undernutrition, increasing prevalence of overnutrition is also there, with overweight, obesity, and lifestyle disorders and non-communicable diseases. So what did government do? What is the government of India's action? It has taken so many reforms, so safety net programs in order to improve this delivery on nutrition and food security targets. So they have launched the National Food Security Act 2013 and National Nutrition Strategy by the Plan India, and the National Nutrition Mission which that is Poshan Abhiyan, which have the aim of promoting the convergent approaches. So with multi-dimensional, I think Dr. Subbaya has already talked about how these convergent approaches are there in the last week's sessions. So in such positive policy environment, government efforts to address malnutrition and food insecurity to actually to accelerate the progress for achieving the targets of SDG, especially the goal 2, that is zero hunger. And the government has devised several nutrition intervention programs under different government ministries. So what are these nutrition interventions? So we can divide these nutrition interventions into three main components. One is nutrition specific interventions, like intervening into the specific causes, like exclusive breastfeeding. We know that there's only 50% of exclusive breastfeeding up to 6 months of age. And then talking about the complementary feeding and dietary practices, fortification, micronutrient supplementation, and treatment of severe malnutrition. These are the specific interventions. And sensitive nutrition sensitive interventions, like focusing on the underlying causes of how, like what about their household food insecurity, or maybe their poor caring practices and unhealthy environments. Then the third one is building an enabling environment, that is to achieve this nutrition security by creating an enabling environment by building the institutions, or developing the institutions. These approaches include poverty reduction strategies, governance capabilities, disaster crisis management, and environmental safeguards. So what does the Nutrition Food Security Act talk about? It was notified on 10 September 2030 with the objective of providing for food and nutrition security in human life cycle approach by ensuring access to adequate quantity as well as quality of food at affordable prices to people to live in a life with dignity. So the proposed legislation marks a paradigm shift in addressing the problem of food security, where it is a current welfare approach to a right-based approach. So now the Food Security Act is a right-based approach. And about 2/3, that is approximately 67% of the population, will be entitled to receive these subsidized food grains at targeted public distribution system. And in our country, where almost 40% children are undernourished, the importance of this scheme increases significantly. And the Food Security Act converts these legal entitlements for existing food security programs of the Government of India. So we have these food security programs, which is midday meal scheme under the Education Department, ICDS under the Women and Child Development Department, and public distribution system under Food and Civil Supplies. So further, these National Food Security Act also recognizes the maternity entitlement. So under the maternity entitlements, where the mother has to be given the paid leave even in the unorganized sector, and there's also a program which has come up to meet this maternity entitlements. And the midday meal scheme and ICDS are universal in nature, where these will reach about 2/3 of the population, that is 75% in rural and 50% in the urban areas. So the features of this National Food Security Act include nutritional support to women and children, that is pregnant mothers, lactating mothers, and children in the age group of 6 months to 14 years, which will be entitled through the schemes which I've already told you, midday meal and ICDS. And higher nutritional norms have been prescribed for malnourished children up to 6 years of age. Then there is a maternity benefit, so maternity entitlements, which we spoke about, this feature of NFSA. So will we also be entitled for a maternity benefit of not less than 5,000 rupees. And women empowerment. And in the Security Act, they also mentioned that issue of the ration cards will be based will be to the head of the household, that is the eldest woman, not to the man, where the gender also has been taken care. In this eldest woman of the household of age 18 years or above will be to the head of the household for the purpose of issuing of ration cards. And nutrition security is being addressed to the National Cooked Midday Meal Program, ICDS, then Kishori Shakti Yojana, of course now it is Adolescent Girls Program, and also Pradhan Mantri Gramodaya Yojana. So we know that how much all these is leading that we need to prevent this. And it also signifies that investment in nutrition is always a good option, because the cost of malnutrition to the economy is very high, which is 27 times more than the investment required for its prevention. So that means if there is a SAM child in the NRC, Nutrition Rehabilitation Center, whatever the cost we are incurring on that child is 27 times more what we are investing in the prevention. So that means what are those preventive measures which we are taking is, one is the supplementary nutrition programs which are provided through government programs, and then another one is the nutrition education which we are doing it, and also the another one is medical approach or the clinical approach, that is prophylaxis programs. So one is dietary approach, one is clinical approach, and the other is the education or even the dietary diversity, promoting kitchen gardens. So what has been done in the past few years? So definitely investment in nutrition encourages the healthy growth of children, nations, and economies. So there is a twin track approach which has been taken up, that is to continue the scaling up of these proven nutrition specific interventions. I don't think we need a different or a very other new programs to be there, because since we are having so many nutrition programs, so much of being is models and projects has been done, and Tamil Nadu Nutrition Clinic is also one of the successful programs. So there are so many there, but we have to just continue with this scaling up of these nutrition specific interventions and ensure that these nutrition sensitive interventions will have the maximum impact on the nutrition outcomes. So to achieve, there are different several schemes and programs, and all these schemes addresses one of the aspects related to nutrition and to have potential to improve the nutritional outcomes of the country. So under the Women and Child Developmental Programs, which is focused on a life cycle approach and even targeting the unmarried adolescent girls, pregnant mothers, lactating mothers and children, and all these nutrition intervention schemes. Earlier they were separate, but now they all have been brought under umbrella ICDS. So now since 2016-17. And these programs, through targeted interventions, will definitely reduce the level of malnutrition, anemia, low birth weight babies, and also ensure the empowerment of adolescent girls, providing even protection to the children. So it has looked into the holistic approach and in a life cycle approach. So the programs which comes under the umbrella ICDS, under the Ministry of Women and Child Development, are 6 programs are there. That is Anganwadi service scheme. So now no more it is called ICDS. Whatever Anganwadi, the Anganwadi centers which we visit, so that program is not called ICDS now, it is called Anganwadi Services Scheme, which has been brought under the umbrella ICDS. Then another one is Pradhan Mantri Matru Vandana Yojana, PMMVI, which is for the maternity entitlements under the Food Security Act. Then National Creche Scheme for the working mothers and ailing mothers. Then scheme for adolescent girls. Then there is also child protection scheme and Poshan Abhiyan. So coming to each of these programs and in achieving the food and nutrition security, I think most of you know much about this Anganwadi services scheme and what are the services they offer there, which includes the preschool education, immunization, health checkup, referral, health and nutrition education, and supplementary nutrition program. So I will not go in detail about it. And the main objective is to improve the nutritional and health status and the overall development of the child, and to reduce the indicators, mortality, morbidity, and malnutrition, and to achieve effective coordination of policy and implementation, and also enhance the capability of the mother to look after the normal health and nutritional needs of the child. And these objectives have been revised since it is not same as 1975. You can see the last 2 objectives because there was a change in the restructuring of the ICDS program. So which was ICDS mission. Under the restructuring of these ICDS program, they have made though the services are same, there is a redesign of the service package, which they made into 6 components and 10 services. So the 6 components include the early childhood development and education. And this early childhood education and development includes a supplementary nutrition program here. So that means they have made 2 services: early childhood care and education is separate and nutrition is separate. So the development of a child which takes place will not happen without nutrition, or uh, only the nutrition cannot even promote the child's early childhood care and education. So with this, they have included both these into the ECCED component. And then coming to the other component of care and nutritional counseling, here we see that the service, so infant and young child feeding promotion and counseling, what we talk about breastfeeding and complementary feeding is included as one of the service in this redesigned service package. And maternal care and counseling. So you can see that more importance is given to the counseling here, care and counseling, and community-based management of the underweight children. These are the 4 services under the care and nutrition counseling: IVCF, maternal care and counseling, care, nutrition, health and hygiene education, and community-based management of underweight children. Now, the third component is the health services. And the fourth one, which includes the immunization, health checkup, and referral. And fourth one is the community mobilization, advocacy, and IAC, where even in Poshan Abhiyan, Dr. Subbara was talking about the Jana Andolan and community-based events and all that. So now under these programs, we have seen that there is a supplementary nutrition program. So after the which has been included under the Food Security Act, then the supplementary nutrition rules have been framed under the Food Security Act by the ICDS scheme. So in view of this, which these 6 services under has been made under the entitlement under the Food Security Act, and as per the sections 4, 5, 6, 7 of the Food Security Act pertaining to ICDS and PMMA schemes of the ministry, and also as per the clause which is mentioned in the Act 22.3, the central government shall provide food grains in respect of the entitlements under section 4, 5, and 6 to the state governments at prices specified in Schedule 1 of the Act. So it is mentioned at the end of the Act, the Schedule 1 and 2, where Schedule 1 talks about the prices specified and also what to be given to the women and children in these SNP programs. And section 39 of this act talks about that central government may, in consultation with the state governments and by notification, make rules to carry out the provisions of this act. So based on this, even the rules are, supplementary nutrition rules are made under the NFSA Act. And they were notified in Gazette of India on 1/6/2015 in consultation with the state government and other stakeholders. So what are these rules? What is being specified? In the Schedule 2 of this act, the cost norms have been specified, like 6 months to 6-year children, it should be ₹8 per head. And for severely malnourished children, it is the norms which has been specified at the central level, but the state government can also increase and also add to these costs. And pregnant and nursing mothers, ₹9.50. And the nutrition norms, 6 months to 6-year children should be provided with 500 kilocalories and 12 to 15 grams of protein. And severely malnourished children, 800 kilocalories. And pregnant mothers and nursing mothers, 600. Even the adolescent girls also 600. So the supplementary nutrition, the rules which are published on dated 20th February 2017, entitlement specified under these provisions of the said act for every pregnant woman and lactating mother till 6 months after childbirth, and every child in the age group of 6 months to 6 years, including those suffering from malnutrition, for 300 days in a year, as per the nutritional standards specified in the Schedule 2 to the said act, namely the nutritional standards, which include that they have to be given by take-home rations. They have to be met by providing the take-home rations or nutritious hot cooked meal in accordance with the ICDS scheme, and nutritional standards for children in lower and upper middle classes under the midday meal scheme. So we can say that now we used to say that the mothers and children as beneficiaries earlier. Now they are no more beneficiaries under this act. They are called the right holders when we look into these kind of specifications which are mentioned in the Act and this, now they are the right holders of this supplementary nutrition program. So even now we see that there is Matrupurna program. In every state there is a by different name, they are giving hot cooked meal in the Anganwadi centers. So they have actually switched over in distributing the ration to the hot cooked meal based on this Food Security Act. We can see here in most of the states now, I think they are providing hot cooked meals, like Karnataka, Andhra, Telangana, they are providing the hot cooked meals. And whereas in the state of Kerala, they have not still started, Tamil Nadu and Kerala. In North also, in most of the way, hot cooked meal has been provided. And we know in the schools already it is a hot cooked meal. So the preference is given to the hot cooked meal because there is an ensuring, we can ensure that the children or the pregnant mothers are taking the food in the center itself. Yeah, this is the as per nutritional standards, which is mentioned in the Schedule 2, and the type of meal which has to be provided. Yeah, this is the same. So what does this hot cooked meal, full meal, especially for the pregnant mothers and lactating mothers, consist of? This is a sample meal of the Telangana, which I had put it here. So which includes rice, lentil, vegetables, oil, and they have a menu which will be displayed in the Anganwadi center, a different vegetable and a sambar every day, which will be providing 1,192 calories, 37 grams protein, and also 579 milligrams of calcium, which they have, Telangana state is providing 47% of the RDA. And the not only just providing the hot cooked meal in this state Matrupurna program or Anna program, Amruta Hastam, but they're also along with the one full meal, that is they provide everyday egg, milk, and along in the hot cooked meal, rice, dal, and green leafy vegetables. And they also administration of the micronutrients is there, then deworming, weight monitoring of the pregnant mothers, and counseling also. And what about the allowance in case if the mothers are not being mothers are not coming to take the food? So in case, or there is no supply, in case of non-supply of meal to these beneficiaries of the Anganwadi center, any day due to non-availability of the food grains or any other reason, the state governments or the administration shall pay food security allowance as defined in the clause 3 of Rule 3 for every beneficiary to be referred to in Rule 3 as per rate specified in the Rule 11, provided in case of the beneficiaries have not taken food on offer for whatever reasons, no claim of food security allowance shall lie with the state government. So in case if there is a fault lying with the administration that they are not able to supply or there is a non-availability of the grains, then they have to pay the allowance as per the rate. But in case if the beneficiary says that she is not interested to take, so it should, but no claim of that allowance to be made. And the state government shall take action to fix the responsibility on the person or agency in accordance with the procedure laid down if meal is not provided in the Anganwadi center continuously for 3 days or at least 5 days in a month. So thus SNP component of this Anganwadi service scheme plays a very important role in fulfilling this Food Security Act. And also recently I was telling that the states have taken the initiation of providing hot cooked meals to the beneficiaries in addition to the CCE activities, and so that as mentioned in the Food Security Act. So that is with the SNP and the Food Security Act in the Anganwadi service scheme. And in this scheme for adolescent girls, this of course it's going on with the different nomenclature. Earlier it was Kishori Shakti Yojana, and then first it was National Program for Adolescent Girls, then later on to Kishori Shakti Yojana, then it was called Sabla, and now it is the scheme for adolescent girls. During 2017-18, it has been revamped as the scheme for adolescent girls. So here the target group is between 11 to 14 years, both the schools going to school and out of school. Of course, we don't have most of the out of schools, but in case in remote tribal areas where the education is stopped, so they are also being targeted under two components where they have the nutrition component and the non-nutrition component. So under the nutrition component, they are provided again the supplementary nutrition similar to the pregnant and lactating mothers, consisting of 600 kilocalories and 8 to 20 grams of protein and micronutrients for 300 days in a year. Or if it is a hot cooked meal, even it is served in the center itself. And the financial norms will be rupees 9.5 per beneficiary for 300 days. And they also encourage the micronutrient fortification. Yeah, these are the different services which have been covered for the adults and girls. Nutrition provision, IFA supplementation, health checkup, nutrition and health education, life skill education, mainstreaming again out of girls to join in the school, and counseling and guidance. Yeah, under the non-nutrition component, this scheme aims to motivate the out-of-school girls in the age group of 11 to 14 years to go back to formal schooling and skill training under the non-nutrition component. And yeah, those are the other services which I told you, IFA supplementation, health checkup, all these are also being given. And emphasis also made in to have a convergence with the services under the different programs and schemes of the other departments like health, education, youth affairs and sports, panchayat raj, etc., to have the desired impact. And we also have seen the maternity entitlements under the Food Security Act. So the scheme which will fulfill that entitlement is the Pradhana Mantri Matru Vandana Yojana, which has been recently, I think 3-4 years back, it has been launched. And the main aim is that when an undernourished mother gives birth to a low birth weight baby, and this low birth weight, and there will be an intrauterine growth retardation, and which will be difficult again to cope up with the to have a normal weight gain and no, overall development. So it is thought that, and moreover, what happens immediately after the delivery, they go to the work. So because of their economic conditions and the other distress conditions for earning a living. So therefore, further to prevent all that, so that they'll have complete rest, and also not to go immediately to the work, and also to have an exclusive breastfeeding for their young infant in the first 6 months. This revision of Indira Gandhi IGMSY scheme has been made to meet this, is revamped, and then to meet with the National Food Security Act 2013 from 1/1/2007. The maternity benefit program is implemented in all the districts of the country, and it has been brought under the National Food Security Act in 2013 to implement that a maternity benefit of rupees 5,000 to the first-born child is given under this act. So under the Pradhana Mantri Matru Vandana, a cash incentive of 5,000 would be provided directly. It is a direct benefit transfer which is provided into the account of the pregnant mothers and lactating mothers for the first living child of the family, subject to fulfilling the conditions related to maternal and child health. And under this scheme, the mother will be getting 5,000. It's a central entitlement. Central government which is giving entitlement. And again, under the Department of Health, there is a scheme like Janani Suraksha Yojana. If it is an institutional delivery in the hospital, then the mother will get again another 1,000 rupees more. So a total of 6,000 rupees the mother will be getting from the centrally sponsored schemes. But even the Telangana state government and Andhra and other Karnataka government, in addition to the 5,000, they have their own state government schemes. Like Telangana, they have the KCR kit. So where they're almost a pregnant mother will get around 12,000 rupees for the firstborn child. I think in Telangana, they're giving for the 2 children. So 12,000 rupees. And if it is a girl child, 13,000 rupees. So objective of this Pradhan Mantri Matru Vandana Yojana are providing partial compensation for the wage loss in terms of cash incentives, so that the woman can take rest before and after delivery of the first child. The cash incentive would lead to improved health-seeking behavior amongst the pregnant and lactating mothers. The target beneficiaries will include pregnant women, lactating mothers, excluding who are in regular employment with the central government or the state government or PSUs, or who are being receipt of the similar benefits by their companies or organizations or the government. Only those who are not having this maternity leave entitlement and other benefits, they are eligible, even though whatever their economic conditions be. Yeah, so This is implemented by a Department of Women and Child Development in certain states, and in certain states it is by the Department of Health or Department of Health and Family Welfare. So the conditions which they have to fulfill is that for the first installment of 1,000 rupees, they have to register their pregnancy and within 150 days. And for the second installment, they should have at least one antenatal checkup, and which can be claimed post 180 days of pregnancy. And the third installment will be given when the childbirth is registered and child has received the first cycle of immunization, and Aadhaar is mandatory. So the pregnant mother should have Aadhaar. It is Aadhaar linked direct benefit transfer, Aadhaar and account linked direct benefit transfer. So that is what with the Pradhan Mantri Matra Vandana Yojana, where under the Food Security Act to implement the direct benefit transfer is given, and already they are also eligible for the supplementary nutrition program under the Anganwadi service scheme. The National Creche Scheme. So you can see the life cycle approach in these government programs. So it is also under the MWCD, where 90% of the required funds will be provided for MWCD and 10% should be by the NGO. So this scheme, National Creche Scheme, is implemented through NGOs. So whoever the NGOs are, they file the application, and 90% fund is by the central and 10% is from their. So a creche facility which enables the parents to leave their children while they're at work, and where children are provided stimulating environment and their holistic development. Yeah, the scheme, again, the same thing, to provide daycare facilities, improve the nutrition and health status, and to promote physical, cognitive, and social emotional development, and to educate and empower the parents. Again, it gives the same daycare facilities, early stimulation because the children will be even below 3 years, supplementary nutrition, growth monitoring, and health checkup. So it is for the group of children for 6 months to 6 years of all employees, including temporary, daily wage, consultants, or contractual personnel. And the creche center should be at the workplace site in the neighborhood within 500 meters. And these creche timings can be adjusted as per the local area. If there are more number of working mothers, and where maybe it is now to a garment factory where most of the women are going to a garment factory, the creche timings can be adjusted according to those garment factory or to the shift timings, which notes to the parents' need. And the components include that it should be safe and stimulated environment, child-friendly, clean, nutritious, the food, the milk and all, everything is also provided, and love and affection and health checkups also. And in these health creche components, there are also mobile creches. So in case if there is in that area, when there are no creches, there are mobile creche centers by one NGO in Delhi, where whenever there is even a construction site where it is going on, a big thing, road construction or any other building construction site where there is no facility of the creches. So these mobile creche centers can come and have a temporary makeshift arrangements and look after the children. So the other last one which we are talking about is the Poshan Abhiyan scheme, where it is the flagship of the program of MWCD, having the convergence with the various programs like whatever we have talked about: Anganwadi service scheme, Pradhan Mantri Matra Vandana Yojana, scheme for adults and girls, Janani Suraksha Yojana, National Health Mission, Swachh Bharat Mission, and public distribution system, the NREGA Employment Guarantee Scheme, and Ministry of Drinking Water and Sanitation. These are few, and there is also Panchayat Raj Department, Rural Development Department. So with all the convergence of the other departments, mainly to focus on achieving the nutritional status of the mother, women and children. So it lays on the first 1,000 days. So the theme for the breastfeeding week was also first 1,000 days. So the 9 months pregnancy, 6 months exclusive breastfeeding, and 6 months to 2 years to ensure this focused intervention on addressing the undernutrition is the first 1,000 days. And besides that, increasing the birth weight will definitely help in reducing the infant mortality rate, and also it aims at Poshan Abhiyan to decrease the maternal mortality rate. And when the child is taken care of the first 1,000 days, that is up till 2 years, additional 1 year, whatever the interventions which have been given, the services which have been provided to this until 2 years, another 1 year of sustained intervention till 3 years would ensure that the gains of the first 1,000 days are consolidated, because after 3 years, the child can again come into the Anganwadi services scheme. So this first 1,000 days is the important time, which is a make or a break time. That is 270 days of pregnancy and 730 days of 0 to 23 months. And first 500 days is infant is entirely dependent on the mother. That is why now the focus is mostly on these breastfeeding and complementary feeding practices. Once the child is being given complete the exclusive breastfeeding and timely and rightly introduction of the complementary feeding, then the child will not have any poor dietary practices or go into the malnutrition status. So there are definitely fixed targets which are to achieve by 2022, but we do not know whether we'll be able to achieve this. All the states are actually working towards this, but because of this pandemic now in this situation, we have to really think over how much is being done in this. So the objectives of the Poshan Abhiyan is to reduce the stunting by 6%, prevent and reduce undernutrition by 6%, and also anemia by 9%, and reduce the prevalence of anemia in both children and women and adults and girls is 9%, and reduce again the low birth weight by 6%. Yeah, the same thing. And this Poshan Abhiyan envisages to monitor the service delivery also. There is also a monitoring mechanism through ICT and RTM real-time monitoring, CAS, computer application software, and IT-related assistance. So growth monitoring devices shall be procured for Angan. There were a lot of problems in doing the growth monitoring in these public programs, because sometimes scales doesn't work, there were no growth charts and all that. So but now under this Poshan Abhiyan, the funds were in to provide all the scales to the Anganwadi centers. I think now in all the states, whichever the state has claimed these who have put up for the approval of all these, they have all got these growth monitoring devices, scales, and growth charts, and everything is now the software ICDS CAS. So all the supervisors, Anganwadi workers are given the mobiles, which has this computer application software, and where they have to enter the data of all the children in their area, including their height, weight, and their services and everything, whether they've come for the supplementary nutrition and all that. And every state, this is a centralized one, ICDS CAS, which is there. And again, all the states have their own application software. Even Karnataka has a Matru app, I think has launched one app recently, and all the functionaries have given training in this, where they have to enter the data. But there's one problem in this, is that every state has their own apps, and then there is a centralized app, and then Andhra has the nutrition monitoring app. So many apps and so many data inputs are there actually. I think Dr. Subbarao has already showed you this and explained to you about all these components of the Poshan Abhiyan, where the top one is a convergence with all the departments and ministries, and this computer application software, where all the data is being entered into through this CAS. And then we have the behavioral change component, which includes the community-based events, Jan Andolan and IEC advocacy as components under this. And there are incentives for the Anganwadi workers who are really working, and even there is an incentive for the Anganwadi worker who is entering the data in this ICDS CAS also. I think 500 rupees is the additional amount given to the Anganwadi worker for entering the data. And in addition to that, even if there are any innovative methods and innovations where they're doing, they're also eligible for the awards. Then there is training and capacity building. It is called incremental learning approach, ILA. I think most of the states have started and initiated, and Andhra has completed almost 21 modules, and they're repeating once again. Telangana also has done with it, and Karnataka has completed 4 or 5 modules under this training and capacity building. So even these ILA trainings are also going on presently, but due to this present situation, I think they all come to halt. Then there is also grievance redressal mechanism only at the central level, but it is not installed at the state level still. And the nutrition key strategies and interventions which are under this includes convergence of all these interventions like infant and young child feeding and food and nutrition, that is given supplying of ration, immunization, then promotion of institutional delivery, water and sanitation, hygiene, deworming. So these are different components which will work with convergence and with the real-time monitoring and also capacity building. So that capacity building, which is the incremental learning approach, where here they talk about giving the training consistently through methodical and ongoing. So here every supervisors in their sector level meeting will take one module every day, every month, and they talk about the practical issues and problems, what they're going on in this, and they have 21 topics to deal with it. So they have planning and management, maternal nutrition, newborn care, breastfeeding. These are few of those ILA themes where at the sectoral level they are being trained. And for under this incremental learning approach, they have formed a national resource group for the ILA training, and there's a state resource group for this incremental learning approach. And then they have a district resource group where the state resource group will train the district resource group, and the district resource group is training the block level resource group, and the block level is giving training to these field level functionaries. So the main objective is to build the skills and also on understanding of priorities through learning by doing approach, and strengthening the supervisory structures and skills, and enabling the coordinated functioning of ICDS and health programs to achieve the common goals. Yeah, this is what is the key elements: structured supervisory interactions, planned learning agenda with clearly defined outputs and outcomes, and use of evidence drawing upon ICT RTM data, and mechanisms for enabling the convergent actions and cascading system of controlled monthly inputs. Yeah, the BCC, which includes the community-based events. Here, community-based events include, they have guidelines which are brought for the community-based events also, where there is a fund which is given of 250 rupees per event, where 2-3 Anganwadi centers can come together and work on these community-based events and do that. Like it can be a Annaprasana to the child, or a Simanta to the pregnant mothers, or any of such innovative thing or creative thing which can be done, and where the community-based event is done in such a way that in an informal way, the knowledge is being shared to the children. It can be not only to the beneficiaries, but even to their the other gatekeepers of this behavioral change, like maybe mother-in-law, sister-in-law, or husband. So everybody is invited for these community-based events, and where education is given in a very informal approach. And there's also IEC advocacy using all these social medias and print and television and radio medias, and Jan Andolan, where to make feel that it is not the government program, but it is a public program, and where they have to involve and build their institutions and ensure the public participation. So all the IEC BCC materials have been also made in different languages in this respect to the states, and it is being provided, and also it is uploaded in the ministry's website, all the IEC BCC materials. Yeah, this is about community-based events. I will not be going in detail. Yeah, to help the families, especially husband, mother-in-laws, to understand the importance of this health and nutrition, encourage the collective community and family decision. Okay, so these are all the about details about these community-based events, when to do, what, where can be their venue and duration, and providing a name. They can have their own names to the events also, and how the planning has to be done, and who all can they invite, and what are the communication material they have to keep it ready, and what can be the themes for this based events. The first day of entry into the school also can be celebrated. Yeah, Jan Andolan is one thing where I think Dr. Subhay has talked in detail about it. through Jan Andolan. There are also themes under this Poshan Abhiyan for Jan Andolan. Yeah, there are different platforms. And this is the ICDS CAS dashboard of that ICT, that real-time monitoring, where there are indicators and the data is entered into this ICDS CAS mechanism. So these are the different interventions under the service delivery. Vitamin A supplementation, iron and folic acid supplementation, calcium supplementation, immunization, deworming, diarrhea management, and food fortification. So now the food fortification is also an important aspect which has to be taken up by the in public nutrition programs, because most of the states have not actually entered into it. Like recently the Karnataka government has also approached many other companies and all, like how to do the fortification of their supply. And now under this COVID-19 situation, where only the raw material is, there is no hot cooked meal, but the ration supply which is being distributed to the different populations is again under the National Food Security Act. So the food distribution under the COVID-19 is also comes under the National Food Security Act, and they are distributing all the raw ingredients, the rice, dal, and everything under the Food Security Act. Yeah, this is the convergence to transform at national, state, district, and block and village level for the achieving the outcomes. Yeah, these are the outcome monitoring. Like we already told that we have to achieve the outcomes of these different programs and schemes. So what are those outcome monitorings? Are behavioral change is one thing. So behavioral change in what? Like it can be with the breastfeeding, it can be with the complementary feeding, it can be with the dietary practices, and also nutrition outcomes, mortality rate, nutritional status, and all that. IVCF, flow birth weight again, and we have to monitor those things. Then growth monitoring, what about the levels of underweight, stunting, wasting, and anemia? Interventions with the institutional delivery, immunization, deworming, and iron and folic acid. Then water and sanitation hygiene with the clean drinking water supply and sanitation, and infrastructure development also, buildings, toilets, medicine kit, and weighing scales, supply of all the materials. So in spite of all these available, like this is only with the MWCD. With the education department, again, there is a midday meal scheme, then there is a supply of anemia, iron and folic acid tablets to the children, then deworming program is there, where they supply deworming thing with the convergence with the health department. And there are also other prophylaxis programs under the health department, a vitamin A prophylaxis program. Those are all the other programs. Talked about the other earlier programs like vitamin A prophylaxis program, iron and folic acid supplementation, and IDD, goiter control, iodine deficiency disorder control program. All these I've not spoken. I've just spoken about the recent umbrella ICDS programs under the MWCD. So in spite of all these programs, but still food security at the household level is determined by more complex area of factors, like which can be related with agriculture production, local prices, income, and even the availability of transport and effective trade. So concerted effort and convergence by all these programs is required, with particular emphasis on, again, gender equity. So as a nation, of course, India is committed to achieving these SDGs, and many concerted efforts are being implemented to reach this end. And in order to develop the need-based interventions to achieve the targets by 2030 and SDG 2, there is a need for comprehensively measure the current status of food and nutrition security, nutrition intention in the country, and the progress on specific targets set under this SDG 2 for our country. And the challenges include the database is one thing I was telling, that in too many databases, like we have NFHS4, we have so many other reports talking about the nutritional status of different populations, that we do not have a uniform kind of a data entry or a database which will give the real picture. Then quality service delivery, though the programs are well designed, well planned and everything, but what is about the service delivery, how much we are actually giving the quality services to the beneficiaries or the right holders. Then information and advocacy, it is just the IEC materials which are being distributed or being hanged or how much we are able to have the behavioral change in them. Then convergence, though we talk about a beautiful convergence among all the departments, and it is very difficult to achieve this convergence. So everybody thinks that other department is doing, or everybody thinks that it is not their own program or something like that. So convergence is really a problem and a question mark actually. And action. So what responsibility is, like any responsibility which is given to the district level, what action is being taken is not known to the block level, and block level doesn't know what they are doing at the state level. So what action is being should be taken, and what action is taken, what is going on also is not actually, there's no transparency, there is no information percolated, and there is no uniform information which is going on at the different levels. So action will be a problem then. So these are the different challenges, and more challenges are there when we work in the field level, field realities, we will be able to know. And definitely, though we say that our country is scientifically or technologically somewhere, but if you go into the rural areas and into the field level, the situation is really dismal and disheartening. So I really don't know when we will be able to effectively implement the well-designed umbrella ICDS or any other programs for that matter. So it is again with the commitment who are working at the field level, and commitment will come only through motivation. And what is the motivational level of these people who are working there, and what is the budget which has been included under these programs, and what is the honorarium given to these workers. All these matters for the motivation to work. And I think the government also should think into all these, and the success of the program depends not when the government works, but when the community feels that they are the right holders and they should get it, and when they ask for it, and when they come and really take what they require by making the government officers or government people committed. So I think with these few words, I thank you one and all, and hope it was beneficial, and hope I've given some inputs of information which is useful to you. Thank you, and thank you one and all.
Yes, thanks, Dr. Jyothy, for that informative presentation. You have enlightened us about the triple burden, and it's overnutrition, undernutrition, and anemia, which many of the were not knowing about it. Then about the NFSA features, cost of malnutrition, how we can reduce through nutrition education, clinical approach, prophylaxis program. And also you touched upon a very important one, the nutrition diversity that can be appreciated by having a kitchen garden. And also you have, given us an insight about the umbrella ICDS and the 6 features where we have to, the government is working on about pregnant mothers, adolescent girls, and also you have given us an insight about the mobile application to monitor growth and development, the nutrition key strategies, and the intervention ICDS CAS dashboard. As you said, everything is nice to see here. But as you said, when we go into the field and work, it is a big question mark which is in front of us. Whether all these programs definitely go to the beneficiaries, and whether the beneficiaries are getting benefited by these programs. As you said, no,
Yes.
especially the government organizations who are making the policies, no, they should see that it goes to the beneficiaries. When we see in black and white, no, it looks very good that we are, so many programs are there, and beneficiaries can be benefited, but it is a big question mark, as you said. Yes. So thank you.
Yeah, I agree to that.
The input, like, these are, the ICDS has changed now into the ICDS, umbrella ICDS with the 6 features. So I think the students who are here, who do the public health nutrition or extension education in home science and nutrition, they will know, they must be studying about these programs. ICDS, definitely they will be studying about the ICDS programs, but they know only theory because they have not gone into the field how it has been worked on. So unless we go into the field, we also as students or the people who are working in the field of nutrition will not know what's happening that side.
Yes, yes.
So I think more and more people, if they take into their, at least people who are concerned with this, if they can work for it, it will be definitely a good,
Yes.
approach, and we can achieve in future, as you
Yes.
said. Thank you, Dr. Jyothy. And there
Thank
are a couple of questions. Can I ask these questions?
Yeah,
Yeah.
they're in chat box. Yeah, I should
There are
actually
in the
one
chat
more.
box. You can see the chat box, Jyothy.
Yeah,
Yeah, you
I
can.
can see.
Yeah, you can only, take it up. Yes, fine.
Yeah, there is one question on focus on vitamin B12 to be taken by pregnant women. Are there any policies working on it? No, as of now, there are no policies working on the intake of vitamin B12 by the pregnant mothers. So even in Poshan Abhiyan, they do not tell about anything of B12 because national level major deficiency programs are vitamin A, anemia, and IDD. So B12 has not come into as a national deficiency program. So there may be some pockets or some pregnant women may be having due to some reasons, but it has not come into a stage of national deficiency program. So I don't think because of that it's not included in Poshan Abhiyan, and there are no policies also working on it. Then has the pandemic stalled the working of the programs? How is it being sustained as most of the Anganwadi workers are working for the COVID-19 programs? Yeah, some part of the work has been stalled, like providing ECCE, like preschool education to the children. But the other part where they have to meet the food security, that is a supplementary nutrition program, the Anganwadi workers are going to the beneficiaries' houses and distributing the ration. So maybe they're not having the hot cooked meal in the Anganwadi center, but they're providing this ration to the thing. And because of this COVID-19, every state has made a COVID-19 SNP kit. So in the boxes, they have all these rice, dal, and oil and salt and everything. And they made a kit and they've been supplied to the houses, or whatever is feasible with the Anganwadi center level. If in some places Anganwadi worker is going and giving at the delivering at the houses, and in some places in different appointed times the beneficiaries are coming to the Anganwadi centers, bringing their own bags and covers and all that, and collecting the food. That is what is happening. But the other services have been stalled, like preschool education or maybe the counseling, and then the, of course, health checkup is by the health department, health checkup and all other. But I think even immunization, whatever it is, they're all going on. Yeah. What is the role of NFSA with respect to the intervention strategies? Yeah, our role of NFSA mainly is to give technical input to the ministry. And like now Poshan Abhiyan, like we have given our technical input into the Poshan Abhiyan scheme, and we are not being even included in the ELA trainings, incremental learning approach trainings. Only it has been given to the state governments to do with having a state resource group or a block resource group and district resource group. So our things will come under in a two-way. One is to give technical support to the ministry in whatever these implementation of policies and programs. The other thing at the regional centers is the capacity building and monitoring. So monitoring is also to strengthen, but not as an inspection. That is what is the role of the NFSA, and also carrying out the research. So we can't propose any research, like we can propose no post-COVID-19 situation or whatever it is. So the role of NFSA in respect to the intervention strategies is only in what to say, giving the input or information to the ministry, or capacity building, or carrying out the research, but not directly in these services what is being given to the given in these programs. Actually, I should say that when we talk about convergence, and then which is a beautiful thing, but convergence means not with the convergence of ministries and departments, as I told actually in my presentation. Convergence happens when the objective of that program is being reached. Like now, when there is a decrease in the malnutrition or when there is an improvement in the exclusive breastfeeding rate, that means we can say there is a convergence happened at the household level. If there is really improvement of situation or a behavioral change which has taken place at the individual level, in the household level, then we can say the convergence happened. We can't say that when meetings are going on with different ministries and departments and all of them together, we can't say, oh, good convergence is happening, or a lot of meetings are going on, good convergent consultations and meetings are happening. That is not how much is being received at the ground level and to the individual level. That is the actual convergence or the result of the convergence. So I think that's all.
You rightly said that is a lot of, as you said, no, meetings after meetings happen in the offices
Yes.
to implement. But whether they are implemented and gone to the right,
Yes.
people is a big
What
question.
has happened at the down, yeah, what has happened at the down level, like that is what is the actual convergence actually.
Yes, 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 yes. Thank you, Dr. Jyothy. So with this, we end this meeting. Okay. And participants, thanks for participating. As we said, it is open to all. No registration, no certificate will be. It is only knowledge sharing. Okay. So we are, as madam, the volunteer, they volunteer to say that we would like to share the knowledge with the people who are into, with background of nutrition or extension or related fields. So we are having this series for another 2-3 days. We will be having. So tomorrow we have iron physiology to intervention. Okay, this is done by Dr. Thangachan from St. John's. So we will be sending the link to you. Those who are interested can join. It will be really useful to the students and also people who are in the related field. Thank you, one and all. Thank you, Dr. Jyothy.
Thank you all.
There is a link, a form is being provided, feedback form link. You can put your thoughts. Okay, thank you. It'll be there for 10 minutes.
Thank you all. So can I leave, Dr. Sundarwali, madam?
Thank you. You can.
Yes, ma'am.
Okay, thank
Yes,
you.
Thank you. Okay.